Hello, my name is Danisha Johnson, and I will be going over the electronic health record coming to Midtown Clinic. The objectives for today will be learning the importance of electronic health records, explaining the clinical and educational benefits that will be coming with the EHR implementation, discussing the importance of health information exchanges, and what expected changes will occur when the EHR implementation happens. The use of electronic health records are important because the Health Information Technology for Economic and Clinical Health Act of 2009 was the U.S. way of encouraging the use of electronic health records. There were improvement outcomes, which were clinical, operational, and societal. Clinical improvements include quality of care, improved safety, a reduction in medical errors. Operational were improvements for the facilities themselves, like the clinics, hospitals, and doctor offices. And societal improvements include improved research, reduction in cost of health, and improved health outcomes in general. And from there was a meaningful use program that was actually started by the Centers for Medicare and Medicaid Services. So you may be wondering, why now? Why are we implementing an electronic healthcare record? Well, with the use of electronic healthcare records and health information exchanges, there's an opportunity for improved patient care. Quality of care is increased because there's better communication, there's better avenues to get information exchanged, which leads to better patient outcome and better patient engagement and improved healthcare as well. So that all leads to better safety, efficiency, and service. Clinical benefits of having an EHR allows our clinic to receive information from other clinics or doctor offices or hospitals that shows pertinent lab work, diagnoses, radiology images, vital signs, just the important information that shows us why you were there and what happened while you were there. Billing and claims will be processed sooner with the use of an EHR. In addition to that, the Centers for Medicaid and Medicare Services, they have requirements of showing the meaningful use of EHRs, and they have only certified EHRs that are allowed to be used. Data has to be captured, moved, and reported appropriately. Capturing data just shows that we're doing our job at using the EHR system appropriately, so that way we're showing that we're using it correctly and the information is not being misused or misrepresented or just inappropriate in any way. Moving the data just shows like from the hospital to doctor's office or office to office. And then the reporting data includes things like immunizations or just reporting off to the Centers for Medicaid and Medicare Services in general. There are educational benefits with using an EHR. There are better ways to promote education because there are usually reference manuals or resources that provide information on medication, disease processes, and procedures as well. In addition to that, you can find information on lifestyle changes, diet, just general information that a patient would know about whatever disease that they may have, or just helpful hints in having a better lifestyle. And most of the education is provided in a simple and easy to understand manner that is used universally. I wanted to further explain what health information exchange is and why it's needed. It's basically an effective way of accessing and transferring confidential information from healthcare facility or healthcare professional to another healthcare professional, whether it be hospital to clinic or hospital to doctor's office or office to office. There's a high demand for this type of exchange because all medical professionals unfortunately are not going to be in one set spot. So this just allows for correct information to be transferred securely. I do want to go over some expected changes in the first couple of weeks when the EHR is implemented and it's brand new. There will unfortunately be a delay in the amount of time that you'll be there. Be expected to at least be at the doctor's office for at least an hour from when you check in to when you check out. I know our usual is 30 to 45 minutes, and I am sorry for this inconvenience. But once we perfect our craft with the new EHR system, everything should be running back to its normal way. Another expected change is the patient portal. This is an awesome addition to the whole EHR implementation because it allows patients to have access to health information, important appointment reminders, and healthcare related messages. Um, Anything you can think of that will be related to Midtown Clinic, trying to reach out to our patients, you will be able to get everything here in this portal. Here at Midtown Clinic, we expect things from ourselves and from our patients. Our expectations include better time management, improved health effectiveness data and information set, aka HEDIS scores, encouragement of follow through and education from our patients, engagement of ourselves, and engagement from our patients. We hope that our patients are satisfied, they feel like they're being heard, and the education is helpful and they can really trust us. The HEDIS score, like I was mentioning before, is a tool that is used for 90% of America's healthcare plans to measure performance, quality, and other dimensions of healthcare. We really use this tool to make sure that we're providing quality care. Another important factor is engagement. We really want our patients to know that we are fully engaged, and we hope that they are just as engaged as we are to their health care. We want to make sure our health care is organized. We provide the best treatments. We promote health, that we're further seeking knowledge. We communicate effectively. The patient feels like they can collaborate with us, the providers, and that everything is done with dignity and respect. Just to go over everything, I did want to mention that improved healthcare, quality, and safety is our goal with this EHR. We promise to be fully engaged in your healthcare. Everything originated back in 2009 from the HITECH Act and the Centers for Medicare and Medicaid Services with their meaningful use. Healthcare information exchanges should be improved and done more securely with EHRs. As well, there may be a slight delay at first, but there are expected positive results. So we hope that you like this new improvement, and we hope to see you soon.